And I call Mary Kelly Foy to move new clause 2.
Yeah.
Thank you, Mr Deputy Speaker. I beg to move new clause 2 and other new clauses in my name. And before I address these clauses, I want to briefly voice my support for amendments 11 to 13 and new clauses 15 to 17 in the name of my honourable friend for Liverpool Walton, which call for improved regulation of alcohol marketing and labelling, for minimum unit pricing in England and for better assessment of treatment outcomes. Sadly, my honourable friend cannot be here today, as he is with his family and his father Mike, who is receiving palliative care after many months of treatment for lung cancer. I know how important these issues are to my honourable friend, and I want to express my love and solidarity and that of the whole House at this difficult time for him and his loved ones. Mr Deputy Speaker, smoking is one of the biggest causes of ill health and has a devastating impact on our population. It killed around the same number of people in 2019 as COVID-19 did in 2020, and 1 out of every 2 smokers will die from related illnesses. Both the Government and the Opposition support a smoke-free 2030. However, without meaningful action, the ambition will be missed by 7 years and double that for the poorest in society.
Would you accept an intervention?
I will.
She's making an excellent speech, and would she agree with me that Mr Marmot's work on social and health inequalities shows that 0.5% of GDP should be spent on health inequalities like what she's describing in her speech?
Thank you for that intervention. I couldn't agree more. Michael Marmot is one of the most important people around, experts around in health inequalities. To make matters worse, smoking rates among young adults have surged to 25% above pre-lockdown rates. Yet, despite the damage that missing 2030 would cause, there's nothing in this bill which will help achieve the Government's ambition to make smoking obsolete. This is why the APPG on smoking and health, of which I am the Vice Chair, is fighting to get the 2030 ambition back on track. And I was delighted to hear the Minister say in the committee that the Government would review the APPG's proposals as it develops its own tobacco control plan. However, that plan was due this year and expected in July, yet it's now likely to be delayed beyond the end of the year. If the Government is serious about creating a smoke-free England by 2030, then they will implement the APPG's recommendations as soon as possible, and this bill is the ideal opportunity to do so. To quickly summarise new clause 2, this gives the Secretary of State powers to add health warnings to cigarette sticks and papers. The Government are reviewing this proposal but said that more research was needed. Yet health warnings like smoking kills have been shown to be effective on billboards and tobacco packs. So why on earth wouldn't they be effective on cigarette sticks? There have been at least 8 peer-reviewed papers published in the last 5 years to show that the measures are effective. Similarly, new clause 3 would give the Secretary of State powers to require health information messages to be inserted in cigarette packs. This has been a legal requirement in Canada since 2000, where there is substantial evidence to show they work, while research carried out in the UK supports their use here too. In committee, the Minister... Yes, I will give way.
Grateful to her for giving way, and I'd just like to put on record my full support for her proposals. She'll understand, of course, one of the key aims must be to stop younger generations taking up smoking in the first place. Does she believe her proposals will actually help that key strategic aim?
Thank you for that intervention. Most of the proposals that I am, the amendments that I'm proposing are indeed around stopping young people starting in the first place. Okay,
I'm grateful. I just wanted to add that she did say that these were measures in respect of England, but of course they have an effect across the United Kingdom, and quite rightly so, contributing to our aim of having a smoke-free Wales as well.
Thank you for that. Thank you for that intervention. I couldn't agree more. Could I just make a little bit of progress now, if that's okay? Yeah. In committee, the Minister said the Department could legislate already under the Children and Families Act 2040 to require these inserts, in which case, why does the Government not commit to do so now? And moving on, new clauses 4 to 6 address loopholes in current legislation which are addressed by these amendments. Now that they've been identified to the Government, they should be fixed without delay, and today we have the opportunity to do so. A new Clause 4 would give the Secretary of State powers to remove child-friendly branding elements from nicotine products. Currently, there are e-liquids on the market called sweet names like gummy bears, in garish colours and featuring cartoon characters. Surely, more evidence isn't needed to provide that such branding risks attracting children. I will give way.
I'm really grateful to the Honourable Lady for giving way. Is that not really one of the most important of her new clauses, in that as people age and die, often driven by cigarettes, or maybe they manage to give up, the tobacco companies must recruit young people, and this is an indefensible aim of getting young people to start smoking.
Thank you for that intervention, and I couldn't agree more. And tobacco is the only legal product that kills 1 out of 2 of those that use it, and most people start smoking at a young age. So these amendments are extremely important in tackling that.
The figures fairly and back up what the Honourable Lady is saying. 2/3 of smokers in the UK started smoking under the age of 18, and over a third, 39%, started under the age of 16. So what the Honourable Lady is proposing tonight will address that issue in a substantial way, because we need the legislation in place and need to be punished as well. That's the only way to really do it.
Thank you to my honourable friend, and I will be addressing that in these proposals. New Clause 5 would close another loophole in the law which allows for free distribution of e-cigarettes and other consumer nicotine products to children under 18. The Government rejected the amendment, saying there was no evidence that there was a serious problem. But the Minister sympathised with the argument for preventative action. That's precisely our intention. Fixing this loophole is an appropriate application of the precautionary principle. And new Clause 6 would remove the limitation of the ban on flavourings in tobacco products, which applies only to characterising flavours, and extend the flavour ban to all tobacco products as well as smoking accessories, including filter papers, filters and other products designed to flavour tobacco products. In committee, the Minister claimed that it isn't clear how a ban would be enforced in practice, as it would include a ban on flavours that don't give a noticeable flavour to the product. I would suggest he seek advice from Canada on this point, where a complete ban on flavours is already in place and has been highly effective. And with regards to the tobacco levy clauses, they give powers to the Secretary of State to implement the polluter pays levy on tobacco manufacturers. The Minister dismissed this at committee stage as a matter of taxation for the Treasury to consider. However, we are not proposing additional taxation. Our amendments are modelled on the American user fee and the pharmaceutical pricing scheme in the UK. This is...
I really thank my honourable friend for giving way, and would she agree with me that prevention is so much better than cure, because so many adults that are smokers go through a terrible situation of trying to give up one way or the other, and it comes at a huge expense and cost to their health.
Thank you for that intervention. Thanks for that, intervention. And it is a theme throughout these amendments that it's young people and children who start smoking, and most people who smoke say they wish they'd never started, but they do smoke on their children. So these amendments are to tackle the access of tobacco-related products to young people. So I will give way.
thank the Honourable Member for giving way. Would the Honourable Member agree with me that it's often vulnerable children who start smoking and often those in care? So would she agree with me that it's absolutely incredulous that the government has so far said that they won't support these clauses?
Thank you for that, my honourable friend. And yeah, it is absolutely incredulous. I know we've heard that there may be a tobacco plan on its way, but every day that we go by without putting these recommendations in place is another day that someone is dying of tobacco harm and young people are being addicted to nicotine products. So clearly, the discussions with the Treasury, in this case on the polluter pay levy, wouldn't be necessary because the FDA administers the user-free in the US, and the Department for Health and Social Care could and should administer such a scheme here. And finally, to new clause 11, and this has been revised in light of the government's response to our proposal in committee, in which they cited the need to review the evidence base of increasing the age of sale to 21 in more detail, and stating the need for a public consultation. Well, I agree that a consultation is the appropriate next step, so the amendment has been revised to require the government to consult on raising the age of sale of tobacco from 18 to 21 within 3 months of the passage of this Act. To sum up, my amendments address loopholes in the existing law. They take incremental and obvious next steps to strengthen tobacco regulation still further and would provide the funding desperately needed to deliver the government's smoke-free 2030 ambition, funding that the spending review failed to deliver. When I was chair of the Gateshead Tobacco Control Alliance, I saw the damage that smoking does. It shortens life expectancy, increases the pressure on our health services, drives down productivity and drains wealth from our poorest communities. And for everyone in every two smokers, it will kill them. Eventually, the government will have to accept that the measures proposed today are necessary. The only question is, how long will they wait? And how many lives will be ruined by tobacco in the meantime? I urge the government to accept these amendments in full.
Yeah.